So back on the topic of growth in children, as we'd all discussed, by far the biggest determinant of how tall our children are going to be is our genetics, and the genetics is complicated, and there's a wide range of normal about how the genetics are actually expressed in our kids' height. And by far, the biggest, most important controllable variable is nutrition. And as a parent of 7 and as a pediatrician, by far, this is the area where I think we have the most stress and anxiety when it comes to parents are my kids eating okay, and are they maximizing their nutrition to meet their potential, whatever that is. All of us that have had toddlers, preschoolers and toddlers, know how anxiety-provoking some of their eating habits can be. As I've described before in other videos, toddlers and preschoolers have appetites that are very variable, and their appetites in meal times line up infrequently. And a healthy toddler who's eating normally will eat the meal with the family that you can actually see them eat the meal once or twice a week, and the rest of the week, you know, they are grazing a goldfish here, a craisin here, and that's normal. But more and more often, the families who I'm speaking with about nutrition with regards to worries about their child and toddler getting appropriate nutrition and whether they are going to be growing appropriately are kids that are struggling in certain ways. One is that some kids, because of their personality, their temperament, behavioral or parental anxiety, have a lot of anxiety around food, and they have very restricted eating patterns, and they really don't eat a reasonable variety of the nutrients that children need to maximize growth, specifically multiple sources of protein, the appropriate micronutrients, all of those things because of their behavioral eating pattern. 2, some young children have sensory issues and or developmental issues that make it really hard for them to expand their eating repertoire, to try new things, or to eat a lot because they struggle with those issues that really block their ability to eat enough. What I'm leaving out on this list and what I'm not talking about are kids that have combination of complex medical and developmental issues, maybe kids who spent a lot of time in the NICU who would have lots of issues with eating, motility, development, medical issues, or kids with other complex medical problems. I'm purposely leaving them out because they're a separate, more complicated group. So I wanted to share my approach and the things that I'm doing in my practice to help parents with this. One is we talk about normal eating patterns. We try to reduce parental stress and anxiety by knowing the normal way that toddlers and preschoolers eat. 2 is that feeding therapy is a really important piece here, especially when your child struggles from a sensory standpoint or a neurodevelopmental standpoint in their ability to develop a normal broad-based eating pattern. Hugely important. And 3, what can parents do while they are working on these things to support their child's nutrition to help? And that's where I have a lot of different families doing different things, and I'll tell you what I've been trying. At our children's hospital, a lot of the nutritionists are prescribing products like Kate Farms, which is a prepackaged formula. A lot of parents buy Pediatrician, perfectly fine as well. I've been introduced to a product that I've been using more and more in my office that I have found good success with. I am not a paid promoter for this, but I have been using it more, and I feel like it has a lot of advantages. I really enjoy this growth protein shake by True Height. True Height is a company I hadn't heard of before until another clinician and some other people turned me on to it. I've been offering it to more and more families, and a couple things that I've liked about it. One, it's very clean, minimal sugar. I like the quality of the ingredients, and the shake has the full macro and micronutrient makeup to really support growth. 2, True Height actually has done a clinical trial. They actually measured biomarkers of linear growth, something called collagen X, in a small but meaningful population of kids. I think there were 20 or 30 kids in the study, and showed that they actually can, kids who are using the supplement actually have measurable markers of linear growth, meaning that what they say it does and what they say the ingredients do, it actually does. And 3rd, even my pickier kids who don't like or won't drink the Kate Farms or the Pediatrician tend to like the shake and use it. So I think this is a great alternative, while you are working on the things that you need to do to help your child develop healthy, normal eating patterns that promote growth. This, I believe, is a really good product that helps along the way. I hope this helps.